I had brain cancer, and my daughter worked here. Valerie worked here, and she said, "Mother," she said, "we going to UAMS. That's one of the best hospitals there is in the region." I said, "Okay."
Ms. Harris had metastasis to the brain, and what that is when you have cancer somewhere else to the body that moves to the brain. A lot of times you can get radiation, and she actually did have radiation more than once to the spot in the brain. Unfortunately, the radiation didn't work. So then we were left with a spot in the brain that was causing brain swelling and some other problems. And that's when she ended up needing surgery.
So 2016, when I came here and met Dr. Anatakas, Dr. Rodriguez. I mean, and it's just awesome because they have helped me so much.
Traditionally, the type of surgery that we do is something called a craniotomy, where we make a window into the skull. So here is an example of a skull, and typically we cut out windows into the skull. The windows can be various sizes, as shown here, and sometimes they can be quite large, and this requires a big incision, and the healing time is much longer. But in this system, we make a tiny hole that is, as you can see, the size of a number 2 pencil eraser. The incision that I make is actually the width of my index finger, and then we attach a metal bolt, as we call it, but we attach this into the skull, and then we can pass a laser fiber that's very thin and flexible. We can pass it here, and it passes into the brain. What happens is then the laser can heat up the brain spot, and we actually do this in the MRI, so we're getting pictures, and we're getting pictures of the heat map at the same time, so we can direct the laser energy to heat the brain tumor. We're currently the only place in Arkansas that offers this treatment. Basically, because it's minimally invasive, you're able to go home the next day. So it's very useful for people who may have a lot of other medical problems, or maybe undergoing cancer treatments or other things that we don't want to make a big incision and have lots of healing to do, where you can actually just have this surgery and then go home and then get your other treatments.
You know, a lot of people don't get this second chance like I did, but I am just so thankful. UAMS, I'm telling you, it's great. Me and my daughters, spend time together. We got a trip planned in June to go to Branson to see Jesus. And, we do things like this all the time. Every 3 months we go somewhere and do things together, me and my daughters and granddaughter. We've did it for years. And Dr. Anatakas, Dr. Rodriguez, I mean, and it's just awesome because they have helped me so much through the grace of God. And I am just so thankful, so thankful.